3, 2, 1, lift!
More than 550 German, British, and American soldiers came together to hone their medical skills in a field environment at Sennelager Training Area in Exercise Rhino Serpent. Their goal is to treat simulated patients from point of injury or illness all the way through to hospital care and ultimately out of the area of operations.
It's very important to train together so that when something happens, such as now, and an ambulance appears, everything runs smoothly.
The training included a trauma special effects team to prepare mock casualties that would give the soldiers the realism of combat injuries.
And what's really satisfying is when people who have done tours come over and say, you know what, I worked with you last year and it really helped me do the tour, and I had to actually treat somebody, and it really, that's probably the most satisfying part of the whole job.
Trauma team to the trauma bay.
Before the patients arrive at the hospital, it's time for the multinational medical teams to get to work. For example, the first stop after point of injury is a German medic station, followed by a trip in a British ambulance, and then on to the American-run 212th Combat Support Hospital, with all three countries working side by side.
It's quite important because we are in the NATO, and it's the system of the future that other nations have a duty to work together.
Are you injured anywhere? Is there anywhere really sore? Can you tell me?
Besides setting up the hospital in a matter of days, the Rhino Serpent exercise also featured more than 90 training casualties over 4 days of day and night operations, and even included air medical evacuation by helicopter.
It has been a great training opportunity to see 3 different nations come together from over 6 different units, learning how to cooperate with one another, understand the different nomenclature that you would use for the same pieces of equipment, same procedures, and iron out some of those details now so that in the future, when we're downrange, similar to many of the soldiers that are serving side by side now in Afghanistan, we don't have to overcome those issues because we've already done it here in the training environment.
The lessons learned from Rhino Serpent will help the medical professionals provide quality care in an austere environment wherever the mission takes them. I'm Sergeant Randall Jackson, Sennelager Training Area, Germany.